So today we're going to be conducting a presentation on the Doula pilot program. We're doing a billing overview. I'm joined today by members of the CSRA staff and some participants from the Department of Health Doula pilot program. We're going to review the following information during today's session. We're going to go through some basic information about who's involved in the Medicaid program and what we refer to as Medicaid partners are responsible for. Next, we're going to do a brief review of the MedNY website, in particular where your provider manual will be located. We'll talk about doula reimbursement. We'll also talk about how to determine the Medicaid recipient's eligibility. We'll then talk about claim submission methods, and finally, timely billing rules. At the very end, we'll open the floor to questions, and we're going to have you do that by entering your questions in the Q&A feature. The Medicaid Partners section. Here we'd like to discuss information about who is involved in the Medicaid program. So we have the New York State Department of Health, the Office of the Medicaid Inspector General, CSRA. We're the fiscal agent. I work for CSRA as an outreach representative and supervisor. We operate the MedNY system. You also have the County Departments of Social Services, the New York State of Health, the Health Benefit Exchange, the managed care plans, and you as providers. We go through all of these in a little more depth during some of our other presentations that are going to be made available to you at a later time. But during today's session, we're going to focus on some of the highlights here. The New York State Department of Health has the following responsibilities. They set the policy, determine what procedure codes you'll be able to submit on your claims and which ones will be reimbursed and under what circumstances. They determine if there's any required claim documentation necessary. Again, they set the fees and rates. They are also responsible for determining certain types of prior approvals, monitoring for fraud and abuse, determining over 2-year-old claim procedures, and they handle the bulk of the provider enrollment. We've listed the State Health Department's general website at health.ny.gov. The Doula pilot program under New York State Department of Health has a few sites places where you can go for information. There is the Doula pilot program's website, and we've listed the address here. We've also listed the Doula pilot program's email address at doulapilot@health.ny.gov. And for those of you who are preparing to submit enrollment applications, we've listed the address for mailing your provider enrollment applications. That is the Provider Enrollment Doula Pilot, Room A, 129 at 431 Broadway in Albany, New York, 12204. CSRA, or we operate the MedNY system. They are responsible for processing your Medicaid claims once you begin submitting them, for putting the provider manuals on the website, for handling remittance statements and checks. We would mail out your checks or make your electronic fund transfer deposits and mail out any remittance statements or put them out in the website in an electronic or a paper or PDF format, we handle billing inquiries and guidelines at our call center. We conduct billing training either individually or in group sessions. We issue electronic transmitter identification numbers, or ETINs, which are necessary for communicating with the Medicaid program electronically. We operate and maintain the ePACES application, which is the electronic provider-assisted claim entry system, but it can do much more than just enter claims. We also handle the fee-for-service, the maintenance aspect of the fee-for-service provider enrollment. and that would include things like changes of address. And we operate and maintain the Medicaid eligibility verification system that's used to check eligibility of the Medicaid recipients. Our contact information is listed at the bottom of the screen, as well as the MedNY website. You can reach our call center at 800-343-9000, and the MedNY website is located at www.emedny.org. The managed care plans are also involved, will be involved in handling or in reimbursing you as providers. So they would have responsibility to contract with you as providers for their plan, determining what services they covered and under what circumstances, any of their procedures and processes that they need you to follow. They handle recipient education about their plans, would tell you what type of maintenance of records you'd need to maintain if you are billing them. And for their contact information, you would need to refer to the Information for All Providers section of the Medicaid Provider Manual for the different plans and their phone numbers, or take a look at the client's benefit card that they have, their card that they receive from that managed care plan. So as providers, some of the responsibilities that you have include verifying eligibility of the clients via the Medicaid Eligibility Verification System, or MEVS, submitting your claims to Medicaid in a timely manner, which we're going to discuss in more detail later. We're going to talk about the fact that you need to maintain your appropriate medical record data in order to support the bills that you're submitting to Medicaid. You need to keep those records for up to 6 years from adjudication. You need to be compliant with HIPAA guidelines, or the Health Insurance Portability and Accountability Act. You need to make sure that you have obtained an NPI, and that when you enroll, you register that NPI with us. You need to follow the New York State Medicaid rules and regulations. You need to review the monthly New York State Department of Health Medicaid Update newsletter that's published and is available through the eMedNY website. You need to refer frequently to the eMedNY website for any updated information, as well as referring frequently to the Department of Health Doula website for any updated information. We're going to go next into the MedNY website and some of the information that you'll need in terms of billing here. So here we have the self-help section in the upper right corner. We put a little red box around self-help. That's where you can find information about a variety of topics, including ePACE's step-by-step walkthroughs. Some other information here we're going to go through in a moment, but as you can see, the MedNY website, the way it's organized, across the top of the screen, you'll see various tabs to the sections of the website. When you hover over or click on those tabs, you'll be brought to the further information that's found within that tabbed section. On the right-hand side of the screen, you can see a list of other functions that you can conduct through this website. You can log into ePACES, which we're going to talk about later. You can log into the Exchange, which is a place where you can hand files back and forth to us, and there are certain files that you can place there or receive from there, from us. And down a little farther, there's a listserv where you can sign up for emails, messages to be sent to you, and then there's the Medicaid update link at the bottom. You should also pay attention to the center of the screen when you come to this site and see if there are any new messages that have been posted in the notices section. And at the very top, you also have a section that says custom search, and you can search the website for various topics. If you click on the provider manuals link at the top of the page on the eMedNY website, you'll see a page that looks like this. At the very top, you'll see a section that says Information for All Providers, and that has some basics that are found in all of the provider manuals. On the right-hand side, you'll see the MEVS and supplemental documentation link, and that takes you to the manual that explains how to check eligibility and what all of those eligibility messages mean. And that's going to be very important to know if you're going to bill Medicaid directly or a managed care plan, or whether or not the patient has Medicaid coverage at all. Then as you move down on this page, you'll see there's a section that says Select Provider Manual. And the Doula Provider Manual will be found here. You'll see that these are listed alphabetically. When you click on that Doula Provider Manual link, you'll be brought to a page that contains the actual provider manual for the doula services. Right now, this part of the site is under construction, but there will be a provider manual posted here in the near future. You'll also see that you can get to other areas of the site in a number of ways. You'll notice there's a link to sign up for the listserv here to get your emails sent to you for important messages coming from the Medicaid program. You'll also see Doula Provider Communications. So if there are some new notifications that the health department wants you to know about, they can post them here. You'll also see other links to the MEVS and supplemental documentation and the Department of Health's Medicaid Update newsletter website, as well as the regulations. So it's important that you come here before you start doing billing to review your provider manual. Doula Pilot Program reimbursement. Some of this was discussed in the previous webinar, but if you didn't attend or you haven't reviewed the documentation in some of the previous sessions that have been conducted about doula services, we're going to repeat some of them here. Only doulas who serve New York State Medicaid eligible clients who reside in Erie County, and those recipients who reside in all of the zip codes in Kings County except for those you see listed here, except for 11207, 11208, 11212, 11216, 11221, and 11233. Only the patients that you see who reside in those counties, those are the only services that you're going to be able to bill for if those clients actually live in those particular counties. And otherwise, you won't be able to enroll in the Medicaid Doula Pilot Program and receive reimbursement. Once you're enrolled as a New York State Medicaid provider, doulas will be able to bill New York State Medicaid for the following services: up to 3 prenatal visits, support during labor and delivery, and up to 4 postpartum visits. How will the doula services be reimbursed? Well, depending on who the payer is, there'll be 2 different payers that you'll be billing. You're either going to be billing fee-for-service Medicaid, so doulas will bill the Medicaid program directly through fee-for-service via the MedNY system. Or if the Medicaid recipient is enrolled in a Medicaid managed care plan, doulas will submit their claims to the Medicaid managed care plan, which will then reimburse the doula. So it's important to remember that you need to enroll in New York State Medicaid first. Once you're enrolled in New York State Medicaid, you can then reach out to the managed care plan organizations that participate in the Doula Pilot Program and apply to join the managed care organization's Doula Pilot provider network. If a New York State Medicaid client is enrolled in a Medicaid managed care plan or a managed care organization, the doula must participate with that managed care organization and bill that managed care organization according to their billing rules. Doulas are going to bill the New York State Medicaid program using the following fee-for-service procedure codes. Prenatal care visits will be billed using procedure code 99600. And you can bill up to a maximum of 3 billable visits. Labor and delivery services will be billed using procedure code 99499, and that will only allow 1 billable visit. Postpartum visits are billed using procedure code 99600, which is the same as the prenatal, but instead you'll need to add a modifier UA to the procedure code when you bill. And you may bill up to a maximum of 4 billable visits. Doulas will bill New York State Medicaid based on the following fee schedule. The prenatal care visits have a maximum reimbursement fee of $30 per visit. The labor and delivery service has a maximum fee of $300, and the postpartum visits have a maximum fee of $30 per visit. The New York State Medicaid Managed Care organizations that are currently participating in the Doula pilot program are listed here, and they are in Kings County. They have Affinity Health Plan, Empire Blue Cross Blue Shield Health Plus, Fidelis Care of New York, HIP or Emblem Health, Health First, PHSP, Metro Plus, United Healthcare Community Plan, and WellCare of New York. For Erie County, the managed care plans participating in the Doula pilot program are Fidelis Care New York, Health Now New York, Independent Health Medisource, United Healthcare Community Plan, WellCare of New York, Your Care Health Plan. So you need to reach out to these plans if you do intend to treat any Medicaid recipients who are participating with these plans. Eligibility. And here we're talking about eligibility of the Medicaid recipient to receive services. Medicaid recipients are issued various types of cards. They're issued permanent plastic photo cards, permanent plastic non-photo cards, replacement paper cards, and temporary Medicaid authorization forms, which we don't have a copy of on this page, but that's another document that's issued. It's an actual piece of paper that's 8.5 by 11 in size. What you need to remember about these cards is that the benefit card doesn't have an expiration date. If you notice, it has a lot of identifying information on the card. So, for instance, if you look here at this, where there would be a photo card, you can see the client's Medicaid ID number appears, and then the card number, their gender, their date of birth, their last and first name, and their signature, and an access number. But nowhere on here do you see an expiration date. That's why it's so important that you use the Medicaid eligibility verification system to check eligibility each and every time you see a patient. The methods for checking eligibility that you will probably become familiar with in taking care of the Medicaid recipients in the Doula pilot program. You'll use ePaces, which is a free internet-based application, or you can use an audio response unit. In other words, a touch-tone telephone method to inquire about the client's eligibility for Medicaid. Large providers may use the alternate access, which would be the batch and real-time 270 or 271 eligibility inquiry and response transactions. I would say for the majority of providers who have a low volume of Medicaid clients, you'll most likely use ePaces. It's really important to note that eligibility verification is necessary to avoid risk of receiving no payment. So you want to check the client's eligibility each and every time you see them. Eligibility determination will tell you if the client is enrolled in Medicaid fee-for-service or in some type of managed care organization. And the MEVS system will communicate with you the Medicaid and the managed care organization eligibility and plan information, including these things: recipient eligibility status, plan information such as plan name, plan address, plan phone number, and plan code. And it will also communicate recipient demographic information, including the recipient's address. And remember that for the Doula pilot program, it's very important that you remember that you're only going to be able to be reimbursed for Medicaid recipients who live in the counties of Erie or Kings, excluding some of those Kings County zip codes. So knowing their correct address will be helpful. The MEVS provider manual, again, within that manual, the MEVS information in the provider manual section is located. So if you notice on the provider manuals page of MEDNY.org, if you hover over that, you'll see the MEVS and supplemental documentation. And again, there's always more than one way to get to certain information on the MEDNY website. So we showed you one way earlier, and this is another way to get to that information. And the MEVS DVS manual is listed here. We outlined it in red. Here is the table of contents from that MEVS provider manual, and you'll notice how it's broken down into information that you're going to need in order to do the transactions and understand the messages that are coming back. If you do choose to use the touch-tone telephone method or what we call the ARU, Audio Response Unit, Section 3 explains how to do those transactions. If you choose to use e-PACES, then, and also if you're using the touch-tone phone method, Section 6 and 7 describes the eligibility messages that are returned. So you want to make sure that you understand the messages that are being returned, because you only want to treat the patient, or excuse me, you only want to bill to Medicaid for the recipients who reside in the appropriate counties and who have the appropriate coverage. You also want to make sure that you're billing the correct payer. So it will help you to know if you're billing Medicaid, fee-for-service, or a managed care plan. Here's an example of an e-PACES response that you would receive if you checked eligibility. So here's an example where someone checked eligibility and the response that came back said that the Medicaid recipient was not Medicaid eligible. So if you tried to bill this to Medicaid, you would not receive payment. Here's another example. In this case, the Medicaid recipient is eligible. What you have to note, though, is the date of service that you asked about in any of these responses that you get. So at the very top it says, it gives you the client's information that we have on file. So we give you back the client ID you asked about, their gender, male or female, the date of birth, the anniversary date and recertification month for their Medicaid coverage, the county that's fiscally responsible for them, the date of service you asked about, and then the client's name and address information. And the plan date is just the same date of the first of the month about which you asked. So you want to be sure to check eligibility. Here's an example where the Medicaid recipient is enrolled in a Medicaid managed care plan. So in this case, the recipient's enrolled in a Medicaid managed care plan, and the message tells you eligible PCP. So they're eligible for their Medicaid through a prepaid capitation plan, a managed care plan, and that plan is listed at the bottom of the screen. So in this case, you would need to bill that managed care plan rather than Medicaid. Claim submission. We're going to talk a little bit here about the timing of the processing of claims. We're on a weekly cycle processing. Normally, claims that get into us by Monday at 6 p.m. cutoff time are processed in that week's cycle. We create a check and remit the following Monday. The checks and any paper remits are then mailed to you 2 weeks and 2 days from that Monday check date. Electronic fund transfer monies are made available to you 2 weeks and 2 days from the check date, and the electronic remittance statements would be sent out 2 weeks later. PDF remittance statements, which are basically your paper remit in a format posted on our website, those can be obtained on that Monday that follows the processing of your claim. So those you can get a little sooner. So roughly from the time that you submit a claim to Medicaid to the time that you have your remittance information and payment, it's roughly 3 to 4 weeks if everything is done correctly. So now you want to know, how are you going to submit those claims? Well, there are two main ways to submit claims to Medicaid. Paper claims, you can use the MEDNY 1500-03 form. You'll get an initial supply of these claim forms when you enroll in New York Medicaid. And again, these would only be used to build the New York Medicaid program. You would have to contact the managed care plan to find out how they would like you to submit your claims. Additional claim forms can be requested from us at the MEDNY call center at 800-343-9000. Electronically, you can also bill, so you don't need to bill on paper, and electronically is probably your better bet because you can get a more immediate response, particularly using e-PACES. So you could submit your claims to us electronically rather than on a paper claim form. You can also, if you use a billing company or you are part of an organization that has their own billing software, you can use HIPAA-compliant software in the format of the 837 professional format and submit those to us using one of those methods that you see here, the MEDNY Exchange, File Transfer Protocol, or SOAP. So those are some of the methods of handing us electronic files. Again, if you're a small provider, and I would suggest using ePaces to submit your claims. If you do choose to use the paper claim form to bill the MEDNY program, this is what it looks like. It's the MEDNY 1503. It's a proprietary form, so you have to get it from us. The field-by-field instructions are going to be available in the provider manual on the MEDNY website. And as you can see, it doesn't require an awful lot of information. Wants to know some basics about the patient on the top of the form. It needs to know some other additional information in the middle section. There's a few fields that you might need to fill out. And then down on the bottom, it wants to know the date of service and the place and the procedure code and diagnosis units and charged amount and other insurance information if needed. And then an original signature on the form, your MPI number, the location where you rendered service from in the form of a locator code, and the date that you're signing the form. And typically, we ask you to assign a patient account number to the client, and then you'll enter your name and address in the field on the right, bottom right of the form. So those instructions will be in your provider manual once published. And again, this form is only used to bill the New York Medicaid MEDNY program. If the client's enrolled in a Medicaid managed care plan, you'll need to find out from that plan how they want you to submit your claims. Electronically, if you submit to Medicaid, you can use ePaces. This is our web-based application. It is free. You can get to it through appropriate internet browsers. You can use it to check eligibility of the client. You can use it to create and submit claims to us. And you can use it to check claim status of claims you created here or claims that you submitted in another fashion. You'll see all the functions on the left-hand side of the screen. Electronically, ePaces requires enrollment. So in order to use ePaces to bill electronically, you need to start an ePaces enrollment process. Now, you cannot do this until you're enrolled as a Medicaid provider. So first you need to be enrolled as a Medicaid provider before you can enroll in ePaces. Once you have your necessary Medicaid enrollment and an ETIN number, an electronic transmitter identification number, you'll be able to contact our call center at 800-343-9000. You'll select the option in the phone message for option 2 for the ePaces enrollment. You're going to enroll in ePaces using a series of emails after the call center gives you a token number. That's going to be sent to you. You're going to have to provide us with an email address in order to communicate some of this information. You'll reply to any of the emails as instructed in the email. You'll get multiple emails here. One of the emails will instruct you to activate your account by going to the emedny.org enrollment page, so emedny.org/enroll. ePaces self-help documents to help you walk through the ePaces enrollment process are found on our MEDNY website in that self-help section I showed you earlier. And as we continue the process, you're going to at some point enter your MPI and the token number in the ePaces enrollment page and check the box that you've read the confidentiality regulations that are posted here and click the agree and log in. And so at various times you're going to be filling out either this left section, and then at some times you're going to be filling out the right-hand section of the screen according to the emails that you receive. And again, if you just review the self-help document, that'll help walk you through the process. So this is an image of the ePaces login page. We're not going to go through every single field on all of these pages. We just want you to get a sense of what they look like. And once you get enrolled in Medicaid, we'll be offering more sessions and we'll be able to talk you through more specifics. So on this page, you enter your username and password, and again, read the confidentiality regulations and agree to log in. Once you log in, you're presented with the MedNY ePaces homepage, and this shows you all of the functions on the left-hand side of the screen. So these are all the things you'll be able to do with ePaces. The doulas will most likely use primarily the new claim, find claims, real-time responses, and possibly status inquiry and status responses. You'll definitely want to use the eligibility request and response section, and you may need to look at the support file section. This is where you can enter provider information about providers that you may be showing on your claim, other payer information, and submitter information is where you can see when your electronic transmitter identification number certification is due to expire. The user admin feature allows you to add additional users who can go into ePaces on your behalf. We mentioned eligibility inquiries, MEVS, before. If you select eligibility request on the left side of the screen and enter the client's information on this page, you'll be able to check the client's eligibility. And you can do these verifications using either the client's Medicaid ID, or if they didn't present that to you, you can use their name, date of birth, social security number, and gender to do an inquiry. You can also use ePaces to create claims. That new claim function on the left-hand side of the function list allows you to open up this main page. And this is the general information page of a claim where you'll enter some identifying information about the client. As you can see, it doesn't require an awful lot of information. This is also where you tell us what kind of claim you're sending. And these claims can be sent in what we call real time, which means we can give you an immediate response. Then you're presented with a series of tabs, more pages to complete. And you don't complete everything on these fields. We give you instructions for which fields have to be completed. But they include information that you see here. The page is actually longer. At some point, it may ask you for information about, whether the claim is late or not. The next screen is the provider information tab. This is where you might have to enter referring information under some circumstances. So there's a way to tell us who referred the provider to you, or the patient to you. The diagnosis page has to be completed with minimally one diagnosis code in field 1, and more information will be available as they prepare the provider manual. The other payer page is used to indicate if there are other insurances who are responsible for paying for these services. At this time, it's our understanding that the other third-party insurances will not be paying for these services, but you may need to fill out this page in order to get paid by Medicaid. So we can discuss that further when the provider manual is published. The service line page is where you're going to tell us when you saw the patient and the procedure code that you're billing and any modifier that needs to be added, along with the amount that you're charging Medicaid and the number of service units for that particular date, and you point back to the diagnosis that you're referencing. So this particular page can hold up to 5 lines. You can add more lines, but you shouldn't need to. And it's probably best if you bill as services occur so that you don't have your claims becoming too late. So that'll keep you billing in a timely manner. And you'll notice at the bottom of the page you can finish the claim or save it as a draft or delete the claim if you didn't intend to submit it. You can also erase what's on the page with that cancel button. So there's a lot of nice features within ePaces. You can then, after you submit the claim, get a real-time response, and you find that by clicking on the real-time response link on the left. And this is some of the information that will be returned to you. So you'll see the client that you submitted the claim on behalf of, and then you'll see the claim level and line level status of the claim. So we'll tell you if we've paid it or if we've pended it or denied it or rejected it. And then below that, we'll assign a 16-digit number to the claim, which we would store in our system, and you would need to use that number if you needed to do any adjustments of previously paid claims or voids of any previously paid claims. This will tell you also line by line whether we paid, pended, or denied a particular claim line. And then we'll tell you the specifics about that claim line, the procedure code modifier, the line charge, the paid amount, the quantity. And the status date is the date that you got the response back from us. So remember to send or receive electronic claim information. Regardless of the method, you're going to need an ETIN, an electronic transmitter identification number, and a certification statement. And that certification statement is updated annually. Initially, when you enroll in Medicaid, that is part of the enrollment process. So that will be taken care of during that enrollment process. Then there is a trading partner agreement. The form is found on our MedNY provider enrollment site. You'll need a user ID and a password once you enroll in ePaces or enroll in whatever method you're planning to use to communicate electronically. And we also have electronic remittances, or what we call PDF remittances, if you want to receive an electronic or a PDF remittance. So there's a form for that as well. Electronic payment and other responses. So we can deposit your funds directly to your checking or savings account. That's done after you fill out the electronic fund transfer application form, and that is part of the enrollment process. Initially, when you first start billing Medicaid, if that process hasn't completed yet, you may get some paper checks initially, but once your electronic fund transfer is put into effect, your money will go directly into your account. PDF remittance statements. The PDF version of the remittance statement is basically the paper remittance statement, but we deliver it to our eMedNY exchange. So we hand it over to you there, and you have to go and pick it up and retrieve it every time one of those is created. And they're only stored for a brief period of time, so you need to go in every week and retrieve them there if you choose to get a PDF remit. And if you're large enough, you may be requesting an 835 electronic remit, and that requires software to interpret it. So, you know, I envision, you know, if we're talking about smaller providers who, you know, aren't doing an awful lot of billing, they may be utilizing the PDF remit format. Medicaid does require all billing providers to register for electronic fund transfer. That's why it's part of the application process. And you should also, once you have your enrollment and your ETIN number assigned to you, you should request the PDF remit, or if you're large enough and have or are using a billing company that you're working with, you might use the 835 electronic remit. This is an example of what a practitioner remittance would look like. So this would be a paper remit or an PDF remit. So you can see we tell you which cycle the remit has been created in and the date it's created. Your information will appear on the left, and on the right-hand side will be your provider ID and NPI number and a remittance number that we create and assign to this remit. Down below, you'll see each of the claim lines that you submitted to us and the client's office account number that you created, the client's last name, the client's Medicaid ID number that you submitted on the claim, the 16-digit number that we assign called a transaction control number, or TCN. It's also referred to as the payer claim control number. Then the date of service that you submitted on your claim, the procedure code and modifier if it needed one, the number of units that you billed, how much you charged us, and how much we paid you. Then the status of the claim appears. It's either going to be paid, penned, deny, adjust, or void. And over to the right, if you made any errors, then you're going to see those error codes appearing over here in the error column. At the bottom, you'll see totals. You'll see the total numbers of paids, pendeds, denieds, and so on, and both in terms of dollars and number of claims. Timely claim submission is our next section. It's important that you review the policy in the provider manual and on the MedNY.org website. It's also in the information section of that website. And this just summarizes some of the rules regarding timely claim submission. Initially, you need to submit your claims within 90 days of the date of service in order for them to be valid and enforceable, unless your claim is delayed due to a circumstance that's outside of your control. Claims that are submitted after 90 days must be submitted within 30 days from the time the claim submission came within the control of the provider. If the claim is returned to a provider due to data insufficiency or claiming errors, so if your claim is rejected or denied, you need to correct it and resubmit it within 60 days of the date of notification. In addition, any paid claims that require correction or resubmission must be submitted as adjustments to the paid claim within 60 days of the date of notification. In most cases, adjustments rather than voids must be billed to correct a paid claim. And claims that are not correctly resubmitted within 60 days, or those that continue to be not be payable after the second resubmission, are neither valid nor enforceable. So the bottom line here is bill as close to the date of service as when you rendered that service, and make sure that if you do have a problem, and for instance, you make an error and the claim is denied or rejected, or you have any of the other appropriate reasons for submitting a late claim, that you do so quickly. This is an example of the MedNY delay reason code form. So if you do submit a paper claim to us, then you're going to need a delay reason code form attached to that late claim. So you would attach one of these forms with every late claim form that you submit to us. And if you refer to the billing guideline, timely billing guidelines in the Information for All Providers section of your provider manual on emedny.org, you'll be able to see what that letter looks like and print it out and print out the instructions. You'll notice there are several reasons that we allow for submitting claims late, and the rules surrounding all those reasons are explained out on that emedny.org website in the in the information table or in your provider manual. So as you can see, you'll need to identify the client's ID number and the dates of service that are on the claim. You'll need to check off the appropriate delay reason and then sign it and give your title and fill in any additional information they ask for depending on the reason you chose. These are the late reasons. Proof of eligibility unknown or unavailable. So you didn't know that the client had Medicaid at the time you saw them. Litigation, so if a lawsuit had to be settled first, that's a valid late reason. Authorized delays has to do with the health department giving you permission to use delay reason 3. So you would need some written authorization from them to use 3. Delay reason 4 is delay in certifying a provider. So depending upon when you get enrolled, that may affect your ability to use delay reason 4. So if you read your enrollment letter carefully when you receive it, you may be able to use 4 depending on the timing of the services that you render. Delay reason 6 you would not use. Delay reason 7, third-party processing delay, has to do with having to bill another insurance prior to billing Medicaid. Delay reason 8, delay in eligibility determination, is referring to the Medicaid recipient's eligibility in Medicaid. So if their eligibility changes and they make them covered for an older date of service, you may be able to use 8. Original claim rejected or denied due to a reason unrelated to the billing limitation rules means that you billed it on time or with a valid late reason, and your claim was either rejected or denied for something that had nothing to do with the claim being late, or you're forgetting to put a late reason or using a wrong late reason. Administrative delay in prior approval will not affect you. Your services don't require prior approval. 11, other, is primarily used for the things that you see there: interrupted maternity care, adjustments of paid claims, IPRO denial reversal. I would say more than likely if you needed to adjust a claim, you might be using that if your claim was over 90 days old, but I don't see you using the IPRO denial reversal or interrupted maternity care. And then number 15, natural disaster. So that would be if, for instance, there was a hurricane or something like that, and they declared a disaster area. The state might give you permission for that. But that's it. Those are the only late reasons. So if you don't follow the rules for billing in a timely manner, you will not be paid. So in terms of upcoming training opportunities, CSRA Provider Services has regional representatives, and they are available to conduct various types of training. So we can do group training sessions, we can do individual training with one-on-one with a doula, we can assist you with a variety of MEVS related topics. We do offer training webinars and in-person training sessions. Those are going to be made available in the next few months. You should continue to refer to the training page at MEDNY.org for the seminar and webinar offerings as they're made available. And also refer to the Doula website page for any information they publish there. If you do want to request individual training or assistance from your regional rep where you're located, you can contact our MEDNY call center at 800-343-9000. So do make sure you take advantage as you get closer and closer to billing for services after you get enrolled. Go to the MEDNY.org website and take a look at some of the other sessions. We offer a lot of sessions on e-PACES, on new provider sessions. We offer sessions on the MEDNY website review. So I would definitely go there and take a look at some of the information that's made available to you. You can possibly attend one of the existing webinars or seminars that we offer. We'll be posting the next set of quarterly, our normal quarterly schedule will be posted very shortly for the upcoming January through March training period. But you'll also more than likely see other sessions specific for doula coming up in the near future too. At this time, I'm going to just point out these are some of the reference and contact information that we pointed to earlier. So you have the MEDNY.org website. You have the New York State Department of Health's Doula Pilot Program website at the health.ny.gov/health_care/Medicaid/redesign/Doula Pilot. You also have the email address for the Doula Pilot Program at the Health Department. That's doulapilot@health.ny.gov. And if you do need anything else, you can contact our MEDNY call center for assistance or training, and that's at 800-343-9000. So at this time, what we're going to do is break for a moment and open the floor for questions. And I'm going to ask that you go to the top of your screen where it says you are viewing Rita's desktop. Click on the link over to the right, top right. There will be a little arrow, and you'll click on the Q&A section, and you can enter your questions there. And we're going to give you a moment or two to enter those questions in that, and then we'll start answering them. In the meantime, I am going to just take a look here and see if Jonathan and Jason from the Department of Health Doula Pilot Program want to make any other comments before we start answering questions. So I'm going to, let's see. Jonathan, are you able to unmute yourself?
Hi, Rita. Can you hear us?
I can. Great.
Hi, everybody. This is Jonathan Lang with the New York State Department of Health. First, I want to say thank you so much, Rita, for the presentation that you did. A really fantastic job, again, of covering some very complicated systems. And so I really appreciate the time that you took to provide this training. And I just want to remind folks, too, that this is the first of many offerings that we're going to be doing regarding billing. We know that there are a lot of providers out there that are unfamiliar with billing, and so this is just the first of many to get you familiar with how to bill the Medicaid program, and then we're going to be working with our colleagues at CSRA on additional offerings, additional webinars, and even some in-person opportunities to learn more about how you can bill in a timely manner. So if folks are a little bit overwhelmed and feel like this is a lot of information to digest, well, the good thing is that the program doesn't go live until March 1st. So there's plenty of time to learn, and once again, there's going to be many opportunities between now and then to become familiar with our billing system.
Thank you for that. I see we do have some questions coming in, so I'm going to read this one. I'll try to attempt the ones that I definitely know the answers to, and if you think there's something you want to add or you want to jump in on one, just feel free. The first question that I see here asks, are all Medicaid recipients required to belong to an MCO? And the answer to that is there are rules around who has to be enrolled in a managed care organization. So no, not every recipient is enrolled in a managed care organization. That's why we tell you you need to check eligibility through the MEVS system to see if somebody is enrolled in a managed care organization. And then the follow-up to this was, if yes, if they're enrolled in an MCO, then when would a doula bill straight Medicaid as fee-for-service? So, again, you'll bill Medicaid fee-for-service if they are not enrolled in a Medicaid managed care organization. The next question asks, Univera Healthcare is participating, however, it is not on the list. Do you know anything about that, Jonathan?
Can you repeat that for me, Rita?
Yes, they said Univera Healthcare is participating, however, it is not on the list.
So what we'll do is we'll just double check with our colleagues at the Division of Healthcare Planning and Oversight, just to make sure, contract and oversight, but we'll just make sure and revise that list if there's any errors on that.
Thank you.
Yeah.
Okay, somebody's asking, please use an example for the requirement of 90 days submission of claims within 30 days of being within the control of the provider. The addition of the 30 days makes it unclear. Well, what they're talking about there is, so if your date of service was, let's say your date of service is March 1st, right? And for whatever reason, it's now August, and you want to try to bill Medicaid. The 30-day piece of that relates to some of those timely filing reasons. So some of the timely filing reasons are allowed to be used 30 days from when something comes under your control. Like if you had to, if the person didn't have Medicaid on the date of service that you saw them, and then they applied and the Medicaid coverage for that patient was backdated to the date you saw them, okay? So that means their eligibility file was changed after the fact. So you would have 30 days from when their eligibility file was changed to submit that to us with that as your late reason. If you're talking about a claim that denied, so let's say for the sake of argument, you saw them in March, you billed, but you made a mistake on your claim. you transposed the procedure code. So you used a wrong procedure code, and we denied the claim telling you that that procedure code was no good. So in that case, after that denial, you would have 60 days to figure out what's wrong and resubmit the claim to Medicaid with that as your late reason if the claim was now late, if it was over 90 days old. So I hope that helps to explain that. How does the doula, the next question is, how does the doula billing work for FQHCs, for federally qualified health care centers, regarding clients with straight Medicaid? Will they be billable?
So we're currently looking at that. So that is a scenario that will be addressed in further billing guidance regarding how FQHCs will be able to bill or not bill according to the guidance I received. I would say that in those instances and in many instances, what we're trying to do is reduce the barriers for folks who may have employees who are doulas. And so we're looking to see how are ways we can encourage and increase participation. And so that's the direction we're going in, and we'll be issuing that guidance shortly.
Thank you. The next question asks, if a mistake is made, are you given the opportunity to correct it, or would you be penalized? Well, if you're talking about submitting a claim and maybe realizing that you billed for a date when you didn't see the patient, right? You would need to go in and void that claim. So you would need to do that as soon as you recognize that that mistake is made. So you do need to take steps to review your billing and your payment information to ensure that you're doing everything accurately. But if you did bill a claim and it was denied, we mentioned already, you can rebill a denied claim. So I'm not really sure what you mean by being penalized, but you do need to look for your own mistakes. I mean, there are times where if you are doing things inappropriately, you can be audited and you can be subject to whatever type of action the state or those agencies want to take, depending on the circumstances. So you do need to, scrutinize what you're doing and make sure you're trying to do it accurately and fix errors that you have made. Somebody's asking, do we bill them as professional or institutional claims? At this point, doulas will be billing as professional, so they're an 837 professional file format. Will there be specific diagnosis codes to be billed with the CPT codes that have been listed?
So those specific ICD codes are currently under development, and we will have an update hopefully by the end of this week regarding the ICD codes for the diagnosis codes that will be used.
Very good, thank you. So far, those are the only questions that have come in. I'm going to check one last place and see if any others came through. And I do not see anything at the moment. I'm just going to look again in the Q&A feature. And that seems to be it for the questions that have come in. So at this time, Jonathan, do you have any other comments or questions that you or Jason would like to make?
I don't. I just want to say thank you, everybody, for your participation in today's webinar. Thank you, Rita, for putting together this wonderful presentation. And just to remind folks that there's going to be ongoing information made available on the website. The information has already been provided. And if you have any specific questions that you want to email the Medicaid program directly, of course, you can do that at doulapilot@health.ny.gov.
Very good. Thank you, everyone. Thank you, Jonathan. Thank you, Jason, and thank you to my team who were present as well. Thank you to all of you who attended, and have a nice day. We'll end the conference now.